Hello, my name is Nigel Pitts, and I'm going to share with you a presentation on the global burden of caries and cavities, including the economic impacts. And it's a pleasure to be here. I am very grateful for the invitation. So how we're going to organize this rapid trip through the Alliance for Cavity-Free Future is to tell you a little bit about the organization, our goals, who we are, and the context of where we are right now, how the ACFF approaches the problem of the global burden of caries and cavities, how we can estimate the size of it. I'll take you through the ACFF Caries Puzzle and our local or global versions of that puzzle, and through a global collaboratory, for Caries Management. I'll tell you about 3 dental policy labs we've run over a period of time, and a current initiative in the policy space, Making Cavities History, and the task force that we run. And then some exciting potential next steps with the WHO resolution on oral health. We'll talk a little bit about the economic aspects, which are not very well developed in this space. And then lastly, I'll finish by telling you about how I think the dental hygiene community can contribute and collaborate more. You're doing it already, but I'm sure that we can do more and be more effective. So to start with, the Alliance for Cavity-Free Future has 4 global goals. The first is our stretch goal that every child born in 2026 and thereafter should stay cavity-free during their lifetime. We then want the Alliance and its chapters to work to ensure that 90% of dental schools and dental associations accept the philosophy behind what's been called a new approach, but it depends where you are in the world, whether it's new or not, but viewing caries as a continuum. Then the third goal is that the chapters and the Alliance working collaboratively with a broad range of different organizations to achieve a reduction in caries inequality. And that's both within and across countries. And it's in the context of both oral and general health. And then lastly, we work to promote integrated, comprehensive, locally appropriate caries prevention and management. So that's what we are here for. We have 28 chapters working in over 40 countries. And you'll see those chapters set out on that map of the globe. And on the left-hand side, you should be encouraged to see, because we are, that the IFDH has been since the start members of our global expert panel that meets each year. And on the right-hand side in Europe, where we have a pan-European collaborative council, the European Dental Hygienists Federation, again, has been a member of that and from the beginning. So you're part of and you contribute to ACFF, and we're very pleased with that. Now let's take you a little bit around this global collaboratory. It's an interspersed, networked global lab sharing and trying to improve caries management. And it's an umbrella group facilitating the delivery of what's now called preventive dental medicine for caries. And I think this is a really important time that you're having this meeting. It's a key moment in time and hopefully a tipping point, and the WHO resolution on oral health can make that happen. If you look at the 2 sides of this collaboratory, on the left-hand side, we've got the ICDAS Foundation and its 2 elements. We've been working at that since 2002, so about 20 years, and the Alliance for Cavity-Free Future has been going about 10 years. So it's a long development process, but a key moment in time. And what we do is we try and expand and improve our partnerships with organizations such as yourself. We try to drive policy development, and I'll take you through some of that. We support local chapters, and the last time I was allowed to actually travel to a distant country, this is in Poland, supporting our Polish chapter. And we align on best practice. Typically that's been with dentists, but it's increasingly with hygienists, with nurses, and other public health practitioners. And lastly, we're seeking to build an effective, collaborative, multi-stakeholder network. So how do we approach, as ACFF, this problem of the global burden of caries and cavities? Well, the first thing to say is it's really quite hard to know what an up-to-date estimate of that global burden of caries is. We used to have classically the WHO basic methods level, good information and maps like you see on the left-hand side of the screen. But these are now increasingly rarely collected. There aren't nationally representative comparable surveys, and we're getting maps which are out of date and not comparable. So that's a challenge, and we've made recommendations through the Brussels statement about how we can upgrade epidemiology and data collection. It's really quite important to move forward to evaluate what we actually achieve. However, on the right-hand side of the slide, you can see the summary results from the Global Burden of Diseases study that looked at all diseases, and untreated caries in the permanent dentition is #1. Untreated caries in deciduous teeth, #10. So caries is a big deal, but unfortunately not many people know that in the policy space and in many countries. I want to take you briefly around. This is a key part of how ACFF looks at the global burden of caries and cavities. This is the Caries Puzzle. We start with action to public, patients and others. We need to facilitate those communications of where we are with the evidence. We need to communicate that there's shared risk factors with NCDs. Sugar is a big issue for caries and a big issue for many of the other NCDs. Education and behavior change is critical, and that's for public, patients, and all health professionals, not just dentists and the dental team. And it's important as we go round that wheel to cariology to synthesize the latest evidence and translate it into outcomes that are beneficial. Then going round towards the bottom, public health. Public health has been a bit of a problem for caries, cariology, and oral health. We haven't got recognition on that wider stage, although that's changing. And then the next two sections, clinical practice and what we call ICCMS Caries Management, we'll come to those a little bit later. And as we move around the puzzle, we get to action for health professions. And this is an area where we really need, and we're trying to integrate more, put the mouth back in the body. So that's the idealized symmetrical caries puzzle. But we know working around the world that we have to have local adaptations of that puzzle. So some of the sizes of those puzzle pieces will change. And global is an ACFF approach where we use global evidence, but we look at local implementation. And the 28 chapters and groupings of those chapters will ensure that the emphasis of the puzzle pieces make sense in the country or the region where you are. To go back to this collaboratory again, really important that what we've managed to do over the last 4 or 5 years is bring together under this umbrella across the life course from prior to birth all the way through to aging and vulnerable elderly. We need to bring the caries management approach together. So that on the left-hand side, you have the puzzle piece for ACFF. On the right-hand side, what the ICDAS Foundation has been doing in education, in research, in public health, but also in practice. And I'll tell you a little bit about Caries Care International, which is the ICCMS system for everyday practice. This is probably one of the most important, but in a way the most frustrating slides I'm going to show you. It comes from a summary by Professor Richard Elderton in the 1980s and 90s, and it shows the spiral that when we transfer across that dotted line from the very first restoration placed in a tooth, we're starting a spiral. The filling that we put in gets bigger, more extensive, involves more surfaces, and then gradually the pulp becomes compromised, infected. The pulp can be endodontically treated and the tooth crowned and then crowned again. And then if the tooth is lost, that's where it stopped in the 90s. But now we have more technology. We can place implants, which then fail, and we can place further implants. So this is a sorry story for patients, and the costs involved for patients and societies have shown us for decades, 30 years, that this isn't the way to manage caries. But that message hasn't got through. We've been trying to make that message translate into reality. And this slide shows you a 10-year journey from the ICFF Foundation with the Caries Management System, ICCMS. We start top left at Temple. No, we start above Temple, 2010 in Montpellier in France. International group got together and started this journey. We then went to Temple University in Philadelphia in 2012, to King's College in London in 2013, and in 2014 produced an evidence-based guide to caries management for both practitioners and educators. But it was too long, too comprehensive. So 2015, we produced a short version, and to the top right, then you have these 4Ds appearing. That was when people said, this is how we need to make it really simple. And we'll take you through the 4Ds in a moment. If we go along the bottom of this slide, we go from 3 dental policy labs and the Minamata Treaty. I'll tell you about the policy labs in a moment, but Minamata is a UNEP, United Nations Environmental Programme treaty, where we now have on a global basis to phase down mercury, phase down amalgam. And that environmental concern for plastics is also driving us to look at prevention and non-surgical approaches for caries management. Bottom right of the slide, we get to these Caries Care International and the 4D system for managing caries, which we'll take you through. Just want to share that's 75 people to start with from 25 countries, and the Caries Care International is another consensus group from around the world. Why is it relevant? Well, dental associations haven't been standing still. They've been frustrated by the lack of change. And at the end of 2019, the FDI had a policy statement for caries lesions and first restorative treatment. So the policy now for all the dental associations is to move towards preventive dental medicine and using the concepts of ICCMS. In order to try and make that easy to deliver in practice, this Caries Care International group got together, 44 authors from many different countries, grouped together with the 4Ds, and we produced a consensus on evidence into practice. And those 4Ds, if we start at the sort of left-hand side, determine is caries risk. We have to be looking at risk-based care. Different people have different challenges for caries. We have to detect and assess carefully and thoroughly. Then we have to decide what to do, a personalized plan developed with a patient. And then we have to do that with the patient again, and in a variety of ways, looking at preventive as well as minimally interventive operative management, and then risk-based recall. And you see on this slide on the left, some of the editorials in the British Dental Journal that have been advocating the use of this system internationally. If you want to know more about Caries Care International, the website is up there, cariescareinternational.com. There's a lot of information and there's e-learning, and the e-learnings are in multiple languages and available for free. What's really relevant to mention at the moment is we also have Caries Care adapted for the pandemic. And this group, a tremendous group, 13 countries with 21 centers, have been practicing preventive caries management for children using remote, using teledentistry, using non-aerosol generating procedures. So that's relevant at the moment and a look to the future. Now let's move to the policy space, and we convened this task force from around the world to co-create policy recommendations, which fortunately fit very well with the WHO oral health resolution. And these are what we need at a government level and a health systems level to control caries and cavities. The headline figures are stark. Of the global burden of disease numbers, you see 2.3 billion have got untreated cavities in permanent teeth. The costs are estimated to be $245 billion. And whilst dental cavities are largely preventable, they are the #1 condition ranked against all of the conditions in the global burden of disease study, 291 diseases. Caries is unfortunately #1, and we want to do something about that. This is a really important slide from that task force report, and it shows us how caries and cavities is linked to other parts of oral health, but really importantly linked to general health and NCDs, non-communicable diseases. And if we act to prevent caries and cavities, we can at the same time prevent some of those other NCDs, the obesity, cardiovascular disease, and other general health issues. So there's a real symbiotic relationship between caries and cavities, oral health, and general health. And there's a variety of publications available. You've got a full report from that task force. You've got a 2-page executive summary, and you've just got a summary of the policy recommendations. All of those available from the ACFFglobal.org website. Please do have a look and spread the information around. Increasingly, we only published these in March. We've got a number of international organizations endorsing them and working with us. They include the World Federation of Public Health Alliances, WFPHA, IAPD, and a whole host of others. And I'm delighted to say that IFDH is going to be one of those groups as well. There are open access summaries of this whole exercise in the British Dental Journal, aligning pieces of the puzzle, and in the JDR CTR publication from IADR that's been peer reviewed, published, and open access now available. And the great news is we've now got a WHO oral health resolution just announced, and that's going to really help drive these things forward. Great opportunities for everybody, great opportunities for hygienists. So just briefly, the economic side, these policy labs over a period of time have looked at the lack of health economic information available in the caries space. We haven't got good economic analyses of the value of a cavity-free healthy state. There's work going on to put that right, but it's really quite frustrating that we haven't got good health economic information. We've also got to pay dentists, teams, other health professions to control the disease. If we only pay for restorations, we'll only get restorations. And we've done work incentivizing primary prevention, secondary prevention, and tertiary prevention, and trying to link the upstream, the midstream, and the downstream. So that's why we need this radical change, but incrementally that change is coming. We have Marko Vujic from the ADA and Stefan Listel, who've worked together with the task force and done the calculations for us. So that's where we get these estimates, 245 billion, the cost of the global burden of caries, 161 billion in direct costs, 84 billion in indirect productivity losses. So this is an expensive as well as a significant disease. And then lastly, on this rapid tour through caries and cavities, how can you, as the dental hygiene community, contribute and collaborate more? I think you should continue to be part of what ACFF does at every level. The door is open. We've already got hygienists contributing, but we would love to have wider involvement, and we have many chapters around the world. So if you want to get involved, please contact us. I think you should market your skills, particularly in terms of prevention, risk assessment, communication, behavior change. You are the experts at the one-to-one clinical level, and you've got to be able to use those skills. And not all parties, not everybody yet understands that. So where we've got such a powerful skill set in modern caries management, we need to deploy your skills. Be part of the collaborative voice to policymakers. And we're moving towards, and the WHO resolution says we should be moving towards prevention as the default and not an afterthought, which is traditionally what we've had in many countries. But it would be great if you could also support the interface to other health professions, to medicine and to nursing, because that's where the future lies. And then act locally. I don't think you can make any recommendations for all hygienists should do this in every country, because as you know, the regulatory system, the legal system, the professional cultures are all different. And lastly, I want to just share with you an example. The implementation of that Caries Care International 4D can be a worked example in which you can show how much you've got to offer in prevention and control of caries. The risk assessment piece, the detection and assessment with careful recording of disease state, the contribution to care planning, personalized care planning with the patient, not on the patient, and carrying out many of the procedures, as well as getting involved in risk-based recall decisions. That's not just for dentists, it's for hygienists, but it's not just for hygienists. It's also, in a country appropriate way, there are other members and other health workers, including nurses, that can help us deliver care in that way. So in summary, I've taken you through a very rapid trip of how my organization, ACFF, is working to cope with and reduce the global burden of caries and cavities. I hope I've given you something about who we are, what we do, and what's our goals. I've told you a number of different approaches to the problem. There's a lot more detail available on the website. The economic aspects are really important for practitioners, for patients, and for policymakers, but that's a work in progress and we need to do more. And then lastly, I hope I've given you some ideas of how you can continue to contribute to this important area. Hard tissues are important, soft tissues are important, and hygienists have just got a tremendous skill set. So we need to make sure that you can deploy that. In closing, I really got to acknowledge all of the people that have helped and continue to help over the last 2 decades in this caries story, the caries journey. And that's all those involved with ACFF, those at King's College in London, the ICDAS Foundation, and many, many others who've contributed to this journey financially, intellectually, and emotionally. So I hope that's given you something to think about, and I look forward to being able to discuss it soon in the second part of this meeting. Thank you all very much for your kind attention. Bye.